Good afternoon, everybody. My name is Siraj Adams, and I'd like to introduce Mark Knowles, the CEO and founder of Ollie Health. Hi, Mark. How are you?
Hi, thank you so much for having me. Very, very good, and you?
Good. Very excited to have you on the platform and to learn more about Ollie Health.
So yeah, absolutely. I'm excited to. Yes, yeah, I'm excited to share our journey and our product with you.
Great. So maybe you can just talk to us. What is Ollie Health?
Yeah, sure. I think what makes the most sense is if we kind of think about how we came to the idea of Ollie Health, and it's quite clear that our lives are evolving fast. Healthcare is evolving, but the way that we live has completely changed. With flexible work and working from home, the way we interact with work and our family and our health has completely changed. But the healthcare system has kind of remained stagnant. The way that we connect with healthcare practitioners has been the same for the past 5-10 years. I don't know about you, but I've never been excited to go onto a medical website or general practitioner's website. There's kind of a change in the way that we are thinking about how can the everyday South African connect with healthcare services. And that's how we created Ollie Health, which is a mobile platform that allows you to book and access healthcare services from the comfort of anywhere, whether it's on your couch late in the evenings, whether it's at work, if you're working from home or the office, or you're on the go and you're traveling, you can access healthcare services immediately from your smartphone.
That's great. Could you tell us more about the strategy behind it and the trends that you saw coming?
Absolutely. I think that the pandemic presented a lot of challenges for healthcare. There was a massive scramble and an unbundling to try and adapt your services, whether you're a practitioner that's been in the industry for 20 years or you're starting out your own practice, which is an expensive entity to set up. You have to adjust your services for patients. You might have got a telehealth platform, but the problem is, how do patients actually find you as a practice or a clinic? And how do they know that you are using telehealth as a product? And the healthcare system today is still very much reliant on big clinics, waiting rooms. And, we really see that the way the patients are going to engage with healthcare is going to be completely different, where due to telehealth, we can access practitioners from our smartphones. I don't think this will replace in-person care. It just allows us to have another form of connection with practitioners and with services, which ultimately can really save patients a lot of time and a lot of money.
Great. Can you maybe tell us how it works?
Yeah, sure. So Ollie is a fully mobile platform. You can download on iOS and Android, and you can browse by different category of practitioners, whether it's a general practitioner, a psychologist, or biokineticist. We essentially have listings where you can instantly go on and book a time slot with one of these practitioners. We want to make that experience smooth and simple, where you can book on your own terms. The idea is to instantly connect with a healthcare practitioner, and then we facilitate that telehealth session, whether it's a 5-minute checkup or a 30-minute post surgery recovery discussion.
That's great. So tell us about the team.
Yeah, absolutely. So I'm the CEO and co-founder. I have 2 other fellow co-founders, one in Copenhagen, Andre, who's our CTO, and Cameron, who's our head of performance marketing. We're a small team. Our company's still very, very early phase. We only launched at the end of November last year. So we're only 5-6 months in, and yeah, keeping the team quite small, but we're excited to grow and bring on fresh new talent.
Great. So talk to us about traction. How's it going? How's the signing up of doctors and patients?
It's been an absolute whirlwind. I think when you're designing and you create a product or a business, you kind of have this idea and you have this nugget of understanding of what you're trying to solve, and the problem is staring you in the face, and you have sleepless nights on, how can we build a solution that in real life, the way people use something is completely different. And I think like just launching this product has been an incredible journey, because in the 5-6 months, it's evolved from just being a place where practitioners during the pandemic could, just say, hey, I offer telehealth, to becoming a platform where people are actually looking for unique healthcare services that they didn't know existed, that they didn't know that they could get a prescription for 250 Rand with a 20-minute video call. They didn't know that Discovery has these prepaid vouchers that's 300 Rand for a virtual call, instead of spending money on transport to go to a practitioner. So it's been incredible. The growth has all been organic for now. The practitioners that we have over 40 practitioners now on our platform. That's just been through referrals, and over 1,000 patients that are actively using the platform. It's been a whirlwind 5-6 months.
And how's the fundraising going?
It's a gruesome process, if I'm very honest. I don't know if it gets spoken about, or if as a quote unquote entrepreneur, you kind of just meant to grit your teeth and carry on, and that's very much the attitude you have to have. But it's a gruesome process. I think you nurturing this product, and you really want to chat to your customers, and you're trying to grow your business, but you also have to focus on fundraising, and a big part of that is just absolutely crafting like what is the vision of this company, why does it exist, and why is the market worth winning. We like to think of Ollie Health as it's a new distribution channel for healthcare, and it's mobile and it's on demand. People that are millennials and younger, they're not going to be using a med pages to find practitioners. They're old, heavy websites. We need something that's on demand and for the new generation. And, as a distribution channel, we can then match supply and demand. It's not just about what is the size of the telehealth market. It's, well, if we increase distribution through mobile, what does healthcare look like? And I think that ability to really define your message and what your pursuit is and what you're trying to solve, that's what investors care about. And I think in early stage investment, it's still incredibly young in South Africa. I think, if we compare it to other thriving places like Miami, especially now, obviously San Francisco and Toronto, where I worked for startups up there, the fundraising, there's a lot more capital that's going around. Where in South Africa, there's not a lot of VC firms that are typically focused on early stage, because you're investing in the problem and the team, and it's obviously very risky. But if you can craft that vision, I think it helps a lot.
No, that's really good advice. The COVID effect has accelerated grocery deliveries, it's accelerated food deliveries. But the healthcare tech space hasn't really taken advantage of capital investments as much as what's happening in the UK or in America. So that's really good advice. And then lastly, for your clients, why should they go to Ollie Health and download your platform?
I think if you want to stay relevant, you need to have a digital strategy. You need to digitize your practice, whether you're a practice of one or a practice of 6 or a MediClinic. You have to make yourself accessible and marketable to patients. And we just want to provide the platform that does that in a meaningful and trustworthy way. I think it's quite overwhelming if you're a practitioner, you want to focus on, your patients, and you don't necessarily have the skill set of how do I run digital ads? How can I bring in more patients? How can I be a category leader? And we want to help practitioners we want to do all of that so that the practitioners can focus on evolving their practice and really having a better relationship with patients. So that's the core reason, is you need to digitize your practice. and we want to help you do that.
And what type of practices are able to sign up? Dental or only GP?
Yeah, so currently we have most of the major healthcare categories. We are launching women's and men's health clinics, which we're incredibly excited about. I think it's another part about bringing, awareness to these services. I just think that mental health, women's and men's health have just they're under massive pressure, but, a lot of people just don't know where to go to find that help. So we're incredibly excited about bringing on those clinics that have a really unique service offering. And I mean, we have everyone from practices in the small towns in Eastern Cape to Mediwells up in Johannesburg.
That's great. Thank you, Mark. We really appreciate your time, and we look forward to hearing more about Ollie Health and how it has evolved. Is there anything you want to say before I close off?
Yeah, absolutely. If you want to kind of follow our journey and get in touch with us, it's ollie.health, or you can alternatively find me on LinkedIn at Mark Knowles. I'm happy to have a chat and a discussion. And I just really thank you, the work that you're doing as well to highlight these kind of projects. I think is incredibly important, and I think it's going to do a lot to build that kind of entrepreneurial spirit in South Africa. It's time for us to build together, and I think technology can really accelerate the South African economy. So yeah, thank you for this and sharing our story.
No, it's a pleasure. Thank you. I think to the audience, I hope they've gained something around how you've built the business, why you've built the business, and the struggles you've had to overcome to be able to get the traction, and then obviously ultimately get funding. But the purpose of why you've done it is the reason why you're going to be successful. So we hope that more entrepreneurs such as yourself see health tech or digital health as a viable opportunity in South Africa, and potentially, and I'm sure you have international expansion plans as well.
We do. I can't say too much about that now, but we do have some plans in the works. But we do feel like the problem is very specific to Africa, and there's a lot of work for us to be done. And if you don't mind, I would like to just say, like, if you are building something right now, whether it's a side project for now or you're building a business, no matter what sector you're in, I think it's important to understand that, like, you're going to go through so many ups and downs. Like, your confidence is going to take a knock. Fundraising in Africa is incredibly tough, but if you understand that the world is going to be a very different place in 5-10 years time, and it's a worthy pursuit to build, and now is the time to build in Africa. Couldn't have ended it better myself. Thanks, Mark. Hope to see you in the media and the publications of this big investment soon. Thank you so much. Bye.